We now come to the second panel of the day, and this is also on digital hospitals of the future. And I didn't get your name, sir. The gentleman in the audience talked about how digital transformation of hospitals. So maybe we can take this up on the second panel. So for the second panel, I would like to call on stage Dr. A. Subair Khan, Managing Director of Orthomed Multispeciality Hospital. Phanidhar, Group CEO of Medway Hospitals. Dr. N. Kannan, Group Medical Director, Dr. Mehta's Multispeciality Hospital. I think we will need more chairs also. We'll need more chairs also. Dr. Stephen Mathew, CEO, St. Isabel's Hospital. Dr. Surendran P., Medical Superintendent, Sri Ramachandra Medical College and Hospital. Dr. C. Emmanuel, Director, Academics and Research, Gleneagles, Global Health City. Dr. C. Rajesh Kumar, CEO of Venkataeswara Hospitals. Mr. Rahul Talwar, Global Segment Leader, Healthcare, Schneider Electric. So, let's, since the topic is the same as the previous panel, and we heard all the, so let's have it in one way. First, I'll come to each panelist. And very briefly, 1 minute in each of you, very briefly, when we're talking about a digital hospital, your vision of the digital hospital, what does it entail? Very briefly, in 1 minute, if each of you can mention, just the vision. We'll talk about the challenges and everything subsequently. But first, what exactly, because the thing is, we touched upon this lack of uniformity or standardization, because maybe the definition of digital, and the gentleman from the audience also mentioned very importantly digitization, digitalization and digital transformation. So this digital hospital, the vision itself can be different. So starting with you, Dr. Khan.
Good morning all, and thank you very much for the APAC for inviting me for this wonderful forum. And I think this is my second time for such a forum I've been attending. I come from a very small setup, not a big corporate hospital, and everybody was discussing about it should start from the small setup also. I should just brief about our hospital. We started with 15-bedded hospital 10 years before. In fact, from day one, we have made our center digitalized as to some extent, but now we have completely paperless with 100 beds now. To my knowledge, the word digital hospital means first thing is paperless. Second thing, all medical records should be electronized, or as Sir was mentioning, it should be digitally transformed from prescription to the X-ray to the laboratory investigation. Everything should be digitally transformed. It was a simple solution which the resistance most of the time happening with our medical professional getting into it to make it as more convenient we have found a solution for it. That is the templates. See, medical records can be made easily documentable by making it as templates rather than writing notes. So that is what we have come up with a solution, and it's working well with our center.
So primarily paperless and the medical records documentable digitally. Perfect. Venkat Phanidhar, the same question in terms of your concept of a digital hospital. What does it entail?
So thank you so much, and thanks to the organizers for giving me this opportunity. Technology should not limit our timing. Okay, 1 minute is quite a small time for us to actually express ourselves with such a loud and sound question from one of the gentlemen from the audience. Give me 2-3 minutes, but I will make it sure that they're all entertained. I had my own inhibition when I said that I'm very cultural in my attire. Okay, well, I will fit into giving a lecture on technology. I'm so glad that you people gave me the opportunity. That's a good example that technology can fit in anywhere and everywhere.
Exactly.
So coming to what actually transformation to me is breaking the barriers of how we accept technology in our organizations. As a CEO and the P&L head for an organization, I look at three important, there's many, but then three primary things which can transform every stakeholder of a healthcare system. One is the clinical governance you can address with digital transformation. Number two is patient experience, which again is going to affect on your P&L and your brand equity. Number three is your infrastructure and asset management, which is again very important. So unfortunately, we still talk only about HMIS and EMRs. We are not going forward more than that. See, paperless doesn't mean that it is going to transform. It is actually digitalization. It is not digital transformation. I'll give you small examples. Okay, when we talk about, most of you are from hospital backgrounds. You are all from hospitals in administration and operations. Tell me how many of you know what is our readmission levels in the hospitals? I'll tell you, okay. It is approximately around 10%, of which only 6% come back to your hospital. Where are these 4% going? To us, most of us, okay, an episode of inpatient going out after a medical or a surgical treatment, your end of service or end of treatment is the day he leaves the hospital, discharged from the hospitals. But that's not the right thing. The recuperating period is also supposed to be considered as your actual discharge, actual end of service. There is a huge gap between the day of discharge and the actual recuperating period. And we have certain standardized, applications, which general questions will be, put to these patients, and it is not customized specific to the patient. Okay, so but we have applications. We have AI and algorithm-based applications which can be customized to the patient requirements, and we can be still connected, and we can, take care of the patient's health after discharge till the recuperating period is over. Number one. Number two, patient experience. What is the ratio between your unique patients to your consultation numbers in a hospital? Do anybody has a clue about that? It should be ideally 3.5 times. That is, if you have unique patients of around, say for example, 40,000 in a year, it should translate to 1.4 lakhs of your OPD consultations. But in average, we will have only 2.5. That is only a lakh of it. So you are losing on 40,000 OPD consultations. Your retention of customers is down by 1%. 40,000 consultations, if you lose, even if you take a minimal of 2.5% conversion of IP, it is 1,000 admissions per year. With a 30 to 35,000 rupees of RBOP, you are losing around 100 million rupees. 100 million rupees, I mean to say 10 crores of revenue, which translates to, at 20% EBITDA, it's around 2 crores. Okay, I'm coming there. Okay, the third one is about the asset management. Most of us, we know, we run on very asset-light model, okay. Our monitors, simple thing is monitor, okay. You send the monitor from ICU to casualty because there is an additional patient, And when it comes back, okay, you don't have a clue where the monitor's probe is there and where the battery is there. We have excellent AI and algorithm-based, asset management softwares. We don't adopt.
Okay, sir.
Okay, thank you.
I got the point. So you're talking about the applications and basically what you are highlighting, we might be ignoring the way the monetization can be done. Even within the assets management was one part you mentioned. The patient management is also another part, and what we are losing and more optimally monetizing perhaps would be possible if we leverage those applications and those technology better. Dr. Kannan, your concept of a digital hospital.
My concept is very simple. What does digital hospital mean? It's a seamless patient experience. From wearable devices to telemedicine to electronic health records or patient apps, everything should be geared towards patient comfort, patient education, patient knowledge, and patient welfare. That should be patient-centric. Second, as all of you know, biological sciences are not mathematical sciences. In mathematical sciences, 2 plus 2 is only 4, but biological sciences, 2 plus 2 can be 5 or 3. What I mean to say is, the respected doctors from government sector talked about lifestyle diseases. If you take the lifestyle diseases, for example, every patient reacts to a particular metabolic disease in a different way. This I am speaking as a clinician. Take, for example, diabetes. A may not react to the disease in a particular way, different from B. So what you require is trend line of diseases, how the metabolism differs from minute to minute by hour and hour, and this is possible only by digitalization, where you can do trend analysis of the patient as an electronic record by which we can derive valuable clinical information which will decide our management protocols. So digitalization basically means patient-centric, and doctor is only secondary to the patient. That is my idea of digitalization.
Okay, thank you. Dr. Stephen, from the Isabel's hospital perspective, how do you look at a digital hospital?
When we look at what is there in our vision, it's honestly quite different from what it actually is, because to a large extent, when you look at how hospitals are moving towards digitization or digitalization, we tell everyone, whatever you were writing till yesterday on your registers, from tomorrow you enter into computers. So does that really solve the problem? Because the amount of time which is spent on data entry, whether it is in a register or in a computer, is the same or maybe even more when they switch to a computer. So as Sir said, I echo that there should be variables, there should be an effort to reduce the amount of data entry time for every employee group, not just doctors, definitely, especially nurses. If you talk to most clinicians and even patient attendants, the most frequent complaint is when we look at the nurses, they're always writing. And we are the ones who are telling them that they have to write. So every area should have the data that they need on a day-to-day basis, which is automatically captured by a system, and each department should also get the insights they need to make their work more effective. Till we reach that, I think we are quite away from our goal.
Okay, Dr. Emmanuel or Dr. Surendran,
Good afternoon, everyone. I come from a teaching hospital where we have almost currently 2,000 patients inside. Now, digital hospital for me is, suppose for me as an admin, sitting here I should know, I should be able to understand what is happening there without calling anyone. Okay. It should be available to me on my device, what I have, that how many are already gotten into the hospital, how many have got discharged, how many are into the theatre, how many surgeries have been over, is there any complication there, what. So there is a whole lot of things that I need for myself, which I should be able to get it on my device without talking to anyone on the hospital. So it should be digitized such a way that I'm able to retrieve data sitting in my position. Okay. So likewise for any heads in that hospital areas, so they should be able to get their data, whatever they need about that hospital, sitting anywhere across the world, not only here, anywhere across the world. Even I go somewhere, I should be able to get every data on a continuous basis 24/7. So that's what I understand by a digital data. And so hospitals should be equipped in such a way that we get these data continuously.
Okay. Dr. Emmanuel.
Good afternoon, everyone, and thank you, organizers, for inviting me. I foresee in two levels, one at hospital level, another at national level. See, using UHID number or biobar coding, if a person's record accessed or retrieved in any hospital in India, that is digital hospital. See, it requires a lot of interfacing, medical devices, telemedicine, following ICD-10, then CPT, computerizing all information to the cloud system, so that we can have a descriptive, preventive, or prescriptive analytics. Thank you.
Welcome.
So anything, if you make it available, then accessible, then affordable, at the last acceptable, that will reach the patient population and the hospital. Thank you.
Okay. Dr. Rajesh.
So as per the digitalization is concerned, technology plays the important role. In this, various technologies like artificial intelligence, cyber security, augmented reality, virtual reality, also in the platform of healthcare sector, which will be playing an important role in foreign countries. So which should be utilized by us as a growing country. Actually, IoT, Internet of Things, is known by everyone, but the system moves towards Internet of Medical Things. That comes under the platform in which smart devices for the hospitals, for the home care devices, for the healthcare platforms, which will be introduced in the sector. So we are in right track as per we are going in a way. For an example, Ayushman Bharat digital mission. So it was started in 21 September 2021. Within 2 years, nearly about 43 crore people were registered in that digital platform out of 144 crore of population, right? So we are in right track. So we have to introduce many things from the grown countries. That's all.
Thanks for bringing the IOMT part into the discussion. That's interesting. I'm quite surprised no one in both the panels till now mentioned in healthcare digital platform. I believe CoWIN would have been one of the amount of transactions it handled. And anyway, now I'll come to you, Rahul. You have heard all the panelists, and my question is, you have heard even Dr. Rajesh talked about Internet of Medical Things and hardware infrastructure. Now, what is your vision in terms of as a solution provider when digital hospitals we are talking about, but how do you make those digital hospitals safe, resilient, secure? That infrastructure as a solution provider, how would you, because many of these hospital buildings would have very old electrical infrastructure, they would have fluctuating climates considering India. So those are a lot of those challenges. So how do you make them more resilient?
Hello. Yeah. Thank you for the question.
Yes.
I think resilience has always been a number one priority for the healthcare, providers. So, if you think about any hospital, the most important thing is the reliable power. Okay. We want to ensure that the power is always available inside the hospital. Now, it is easy to take it for granted, but actually we should not take it for granted about power availability in hospital. Let's take an example of a surgeon, right? a surgeon will feel confident to do an operation only when he feels that the power is always available for him and he can finish his operation on time. Okay? If the surgeon is at doubt, he will probably not do the operation in this hospital. So what we are seeing in today's time is that that we need to build that confidence for the people who are the caregivers, and we have to also build the confidence for the people who are caretakers inside the hospital. Now, we have seen that, on one side, power availability is a big importance inside the hospital, and that's how resiliency has been built. But on the other side, power quality is also equally important. So we can't take it for granted that a low power quality things could be installed in the hospital building. Let me give you another example. To really protect the patient inside the hospital, we need to create layers of resiliency. Okay, and this is and we call it adding nines to the system. So let's take an example. Let's say the grid that is providing power to the hospital, it says that I am 99% available, 99% reliable, which means 84 hours in a year, this grid is not reliable, and which is not good for the patient who is inside the hospital. Okay, it could make patient unsafe. So what do? We add a UPS to that hospital, and that adds a 9.9% to it. So it makes it 99.9% reliable. Okay? What do we do next? Because 99.9 is again not sufficient for that patient.
Exactly.
Because it is still giving back 10 more hours of unreliable power in a year. So we give another 9 by adding, let's say, power quality monitoring. Okay? It makes it 99.99. We give another 9 by adding, smart switching, which gives powers to the location where it needs the most. So it makes it 99.999. And then finally we add, all the alerts, notifications to the systems to make it nearly 100%, but still it's 99.9999%. Okay? So this is what we think is, to make hospitals resilient. This is what we think. Thank you.
Got the point. So before I come to the last round for all the panelists, just one announcement to be made that just after this panel discussion concludes, we have a felicitation ceremony where we would recognize the achievements of all the healthcare leaders who are present here. So just to inform all of you, and once we wrap up this panel discussion, we have this felicitation ceremony. Now I'll ask one specific question to each of you, separate question, and may I request, just for paucity of time, each of you to answer it in 1 minute, not take more than 1 minute. I'll start with you, Dr. Khan. You had earlier mentioned that you are coming from a relatively smaller hospital, and in the earlier panel we also talked about the democratization of digitization which need. So smaller hospital will have its own separate set of challenges in terms of patient acquisition might not be the right word in business, but for patient coming in. So there, what role you expect digital technologies to play in terms of relatively smaller hospital to provide improved patient care?
So, improving the patient care in a small sector, it doesn't matter in whether the small sector or a bigger sector. The digitalization part definitely improves the safety, quality and efficiency of the hospital. There is no doubt about it.
Yeah, my question was on that efficiency part.
Okay. So the efficiency definitely, because when it starts patients coming from ER to OR, so if it is digitalized, the flow is very seamless, and the errors made by the staffs or the doctors can be minimalized because of digitalization. And you can make more responsibility to the team.
Okay.
For instance, like the most common mistake done in any setup is when it is written or oral commands are passed around to one order from a doctor to a nurse to a technician. That's where things goes wrong. And the responsibility will not be taken care by the individuals. For example, the doctor says to the nurse and the nurse shifts the changes and it goes on. So the solution here, even in a small setup or in a bigger setup, is individually every staff or any person in the team will have an identification ID and a password separately so that they take the responsibility.
Sure.
And the communication is more clear and digitalized. And efficiency is also better.
Ultimately, the goal is to optimize that efficiency process. Dr. Venkat, my question again, 1 minute answer. You talked in the earlier point about the post-discharge. The importance of that follow-up is hardly done post-discharge, especially during the recuperative period. So how do you think an effective CRM solution, how can that improve this situation better?
I'll definitely wind up in 1 minute because I'm hungry. Okay. So let me tell you, so there are applications, okay, which are AA based today, okay, which can actually be customized to the requirement of the discharged patients. For example, they read, okay, in whichever format it is, they read the discharge summary of the patient, whether it is written by hand or through any other mode like PDF or whatever it is. The application reads it and it will customize a post-discharge plan for that particular patient with the timelines and the touch points. Say for example, every patient, say there are 10 patients who have got their knee replacement done, okay, but there is an age which is differentiating their prognosis. There is comorbid conditions like diabetes or thyroid or hypertension, whatever it is. So these will change the outcome of the surgery, okay, and it may delay or fasten the prognosis of the patient post-discharge. So these applications can actually read the discharge summary, take the finer points and create a post-discharge plan for them, which will definitely be very rewarding and the patient experience at the end of care will be much better.
Okay.
Thank you.
Thank you. Thank you. Dr. Kannan, you are very succinct in the first part, your definition and concept of a digital hospital. I have a question is, let's look at the healthcare professionals. So that would involve your doctors, your surgeons, your clinicians and nurses maybe. Now there is a challenge in sort of inculcating digital literacy among them, and there would be in earlier session, ma'am talked about the hospital staff. Yeah, that resistance is different. There is a fear of job loss and things, but in case of a doctor or a surgeon, first he would be busy to maybe, and second, again there would be an inherent resistance to that. So how do you tackle that situation?
Thanks for asking me a question for which I would love to give an answer.
Thank
Because
you.
our hospital is 90 years old and we have got clinicians who are in their 70s and 80s. And as you know, the resistance to digitalization increases with your age. Chronological age is the greatest enemy. I won't say chronological age, it's the mental age. You may be old, but you may be mentally young, and vice versa also. So how do you overcome this challenge among the doctors, especially towards digitalization? One is, number one, a very busy doctor, supposing he is old and is resistant, give him a physician assistant. He will take his burden. What the doctor has to say, whatever he says, the physician assistant observes, notes down, and gets the digital record. And you can give him some facilities like voice to text or even digital pens. We have provided them in our hospitals to enable them to write their prescription and their observation notes, signs, symptoms, management protocols in the digital pen, which will be automatically transformed into digital record. Second thing is training sessions. For middle-aged younger doctors, we provide them training sessions periodically by our IT team, which is a very robust team, which gives them frequent training and tell them what to be done. And once the clinician, whatever maybe the use, get used to electronic health records, he starts loving it. Because anytime, even if the patient comes after say around 9 months, You can easily retrieve the entire records of the previous visit, his condition, and your decision is very quick and very accurate. So the doctor is actually impressed with this system. Once he gets used to it, only there will be initial resistance which can be easily overcome. And the last, my suggestion for improving the digital thing is digital curriculum should be introduced in all medical colleges. You know, as you all know, undergraduate education, they have introduced medical ethics recently, which is a big hit. Similarly, digital curriculum should be used in all medical colleges, in all the medical conferences, all this continuing medical education. A digital chapter should be included, which is taking place in all the recent conferences of Indian Academy of Pediatrics, etc., which is a welcome step.
Okay, thank you. Dr. Stephen, my question I asked in the previous panel also on the teleconsultation part. The teleconsultation graph showed a steep curve up during the COVID period. Now it has again, I would say, rationalized perhaps. Looking at the legal guidelines that came a couple of years back, vis-a-vis the internet connectivity across the country in relatively remote areas, taking all those factors into consideration, how do you see the future of teleconsultation and telemedicine in the overall digital landscape of hospitals?
I think you would have to look at teleconsultation in two environments. One is out of the hospital and one is within the hospital. Out of the hospital, definitely in a country like India, it will definitely help to improve access. But then teleconsultation should not just be a video call. A video call is not a teleconsultation.
Exactly.
It should be integrated with diagnostics, with the pharmacy. There should be a follow-up. There should be a transcription of records. All of that, of course. Within hospitals, I think it will play a larger role over the coming months or even years, where it can enable referrals. Physician to physician communication can be through teleconsultation, where it's transcribed, especially let's say it's a specialty that is not present in a particular hospital, the specialist is sitting somewhere else.
Very briefly, since you are mentioning this, I would, and if briefly if you can answer, there is a huge security challenge even behind that, and the patient privacy thing, which is also now gradually becoming big in India. The security thing is, we all know what has been happening at AIIMS, Delhi especially. So keeping that in mind, that security part of the challenge, how do you see?
I think the software solution has to be robust. So if you look at during COVID also, no one was asking questions about security because the priority was always to get to the patient. So even a WhatsApp call was considered a teleconsultation. But for that, I think it's the solution providers who should really ensure that the security requirements are met. And of course, the government has a large role to play there with strong regulation, especially if you look at what the EU is doing in terms of data regulation, if something on a similar scale can be introduced in India.
Okay, thank you. Dr. Surendran, again, since you are coming from that, also that educational background also, and we heard about digital literacy and training to the doctors. So if you can let us know maybe over the next 12 to 18 months, what are the plans on the anvil in fostering or inculcating the spirit of digital literacy more and actual training on the ground that is likely to happen?
Yeah, the question to him on the security aspect. When the AIIMS was hacked, our servers were also hacked. We were hacked by the ransom and we were asked for $1 million in cryptos. And we were hacked for 1 week and we couldn't operate at all. So definitely the security is a major challenge. The target were AIIMS. There were 5 other hospitals who were caught in between because we were linked to their servers through the Ayushman Bharat and certain issues.
Exactly.
So indirectly we were hit. So it is not that our systems are alone has to be secure. If you are linked to some other servers to any other portal to the government or somewhere, If they are hit, we are also indirectly hit. So definitely the security is an issue. I think this is something that we have to keep in mind because we have lost a lot of medical records in that scenario. So luckily we were in the event of destroying the physical records, we didn't. So now we are in fact storing 10 years physical records in spite of having an electronic form with us right now. So this is a big challenge. As far as training the youngsters, yes, especially we have developed an app for the patient care, for education, for classes. There is a single app that everybody has. So where that app gives my patient, number of patients I have, what are those patients receiving medication that they received, the labs that have been ordered by my students, and what was the result and what they have ordered. So there is a monitoring mechanism through a form of app that we have developed.
Okay.
So I can monitor my 30 patients, what is happening to them now through that, and I can tell them, boss, this is has to be changed, don't give this, or I have a facility to alter whatever is possible.
This monitors real time.
This monitors real time.
Okay.
So all the prescriptions, I can give it from here for my patients. I can order lab for my patients through my app from here. So this is something that we have inculcated. And also we are on the technological front now. We worked with a DNA nudge. I think all of you would have heard DNA nudge from an UK company. We are in the process of getting the DNA's mobile DNA. All of you can hear DNA pattern on your mobiles. This is something that we have envisaged, which the DNA nudge has come out with a preliminary form where you spit on the thing. The DNA, it's a PCR test right now.
Okay.
It will multiply your DNA and it'll study and give a pattern of your DNA. But there are certain limitations to it right now.
Limitations, and there need to be certain security.
Yeah, right now with certain diseases we can diagnose that you are potential for a diabetes or a hypertension and all that. And there is a wearable device connected to that mobile where suppose you buy anything in the shop, if there is a barcode in it, you scan the barcode, it will tell you, no, this is a high risk diet for you. This is a low risk diet for you. This is some kind of all in the preliminary form right now. So we are into the preventive aspect of it.
Okay.
Through the digitalization. This is something that envisaging. We have a lot of time to go through that. So that will be a big success in this.
Got it. Thank you. Dr. Emmanuel, again the training part in terms of all the different stakeholders, from doctors to the administrators to the nurses to the clinicians and all the stakeholders, and they require different levels of training also. So how are you planning to ensure that?
In our hospital, we have a virtual platform. So whoever nurses come, first we'll train them for our complete cranial activity. Second level, doctors. So we have physician assistant by our another doctor. So we have physician assistant, plus some of the doctors are also been part of our training program. So there may not be a problem in that side too.
Okay. Thank you.
Thank you.
Dr. Rajesh, one key challenge in this digital transformation journey which you are immediately facing and would like to mitigate as soon as possible?
Security problem. Cyber security is the path we have to get into the picture. Actually, in 2020-21, in USA, there is a ransom attack was happened. In that, nearly about 148 complaints registered by FBI. In that sector, it is more than the financial sector. So the hackers are targeting the healthcare industry because it is a vast area. So we have to concentrate there and this.
It's perhaps easier to sort of
Yes.
Take you hostage there.
Yes. We have to take into concentration.
Potential is much higher.
Exactly.
Yeah. Okay. So Rahul, you have the last word again here. My question is, what is perhaps least touched in this digitization journey is big or small, super speciality, multi-speciality or any hospital, they will have multiple infrastructure. from buildings. The buildings will have different, then there will be lot of chains, multiple hospitals, within hospital complexes, multiple buildings. Now, you earlier touched upon the resilience part. Now, my question is to make these buildings safer, and perhaps from a hospital administration point of view, this perhaps might not be the area that these gentlemen are looking at in priority, because not because of they are not prioritizing it, but this sometimes falls out of the radar. So as a solution partner, technology partner, how would you ensure that it not only it remains on their radar on priority, but end of the day, ultimately, you help them on those missions more effectively?
Yeah. So thanks for the question again. We are a technology provider, and we are also a low voltage integrator consultant to our customers, right?
Maybe I'll add one part.
Yeah.
In the earlier panel also, that question was put, the budgetary constraints. All hospitals will have budgetary constraints, and when we talk about ROI, but ultimately that's what the expectation is from a technology solution. How do you innovatively manage the budget?
So that's a tough question. But, of course, as Shweta already mentioned, we are working towards, we would work towards helping our customers, create a service as a, software as a service model. There are pieces where we have done that before, and I think in the future we'll do it more rigorously, considering the questions that were asked from the panels before. I think one important point here is about coming back to digitization. So what is important here is so there are so many systems, different systems which is installed inside the hospital building. Those systems, they work differently to give a common cause, that is making sure patient is safe and making sure the things are delivered right in the hospital. But what is important from our perspective is we have to make sure that all of those systems are working together, okay, in tandem with each other. So this is what we bring, and once it is done in a particular hospital, it can be, taken over to the next level, bringing it to different, at the enterprise level to different hospitals as well. So digitization is a journey which we can help our customers with, and digital transformation is a need of an hour, and that's what we do from Schneider point of view.
Okay. Thank you. Thank you. We will conclude the panel discussion here. Maybe we can have a group photograph, and then we will start the felicitation ceremony.